so much for your patience as we navigated our natural nipple motion. And so this final tutorial is really meant for the clinical team, reviewing our telehealth visits and our triage process. However, I would like for any other member of our team just to passively listen to this in your free time so you really get a good idea of how we function together as a unit and what our clinical team is providing for anybody that is coming through and getting a telehealth visit conducted. So I recommend for every team member just to go ahead to thenaturalnipple.com and understand where this resource is recommended. So the first place you're going to see it before actually ordering the bottle is if a parent comes through, a mom for instance, and does the latch match survey. You can see it's loading here. And then they actually identify that their baby has either a congenital malformation of the oral cavity. So once they've clicked on one of these, we offer a free telehealth evaluation and we use the code flow state. So the purpose in this particular visit is you're going to actually, in the virtual visit, assess is it a high palate and actually have the mom in our synchronous Zoom call put the finger in the baby's mouth and press up so you can get an idea on the finger of exactly how high the palate is, have her measure that, and you can do the conversion 2 millimeters and actually add that on to the nipple length measurement that she includes here. So we're really providing her the best nipple after not only her geometry but her baby's oral cavity as well. So I'm going to take a moment and just navigate over to here. This is proprietary, so if you're on the clinical team or on the fulfillment end of engineering, you're going to have access to our latch match data. But for everyone looking at this, we don't want our competitors to know the exact specs of our nipple. However, I do want to make a point that it is patent protected. However, we don't want to spend money in litigation chasing people, and we do know that if they were to replicate the flow rate, because we've protected the process of matching maternal lactation averages to our product, we could pursue them in litigation, just as a side note. So what you're going to see here after you've converted, maybe the mom measures with an object around and it's in inches, you're going to end the telehealth visit and get back to her with what her personalized natural nipple latch match is going to be. But you're going to come over to this table and you're going to see, okay, maybe she inputted on this form here, the length is actually 18 millimeters, but then the baby's palate adds an additional 4 millimeters, right? So that would put you at you're going to look at the range, the length. Is it between 21.5 millimeters to 23.5? Okay, she's going to actually be the Jolie type. And then you can send her a follow-up email to enter that latch match code at checkout. So you can see here on the site, we've all already walked through ordering, so you know what that process looks like. You're going to base it on the baby's age, and then you're going to enter their latch match result there. Perfect. So that's one instance where you would have a telehealth visit. It's not easy to find the visit because we don't really want to promote it as just a standalone service. When a parent purchases a bottle, we do offer a free 30-minute consultation to walk them through how to best use the natural nipple and have success with breastfeeding. So that's the majority of the type of visits you're going to see. I do encourage you, and it is required if you're on the clinical team, to actually walk through and book a visit as if you are the patient themselves. And so that way you're going to see our current template that the patient gets populated and be able to walk through the link and fill out our triage form that they get sent and fill out our intake form, both of which they are encouraged to complete before their visit with you. So you're going to enter code flow state at checkout so you can go ahead and book your free visit. You can see here that won't cost you anything. Then what you're going to do is go through and complete the type form, triage form, and intake form that you are sent. On the back end, as the provider that's scheduled for that day, which I'll go ahead and I'll input your clinical schedule, you're going to get an email notification that somebody has booked with you. So it is important, clinical team, that you are checking your email on a daily basis or that you have those notifications for email turned on. I do have a buffer set up, so I believe it's about 8 hours before, so you are notified. If you're, for instance, if you're scheduled at 9 a.m. and that patient came through in the middle of the night to book the visit, I try to create an 8-hour buffer. So make sure you're checking your emails first thing in the morning. What you're going to navigate to, you already have access to passwords in your training. You're going to log into Typeform, the natural nipple, and you're going to take a peek first at their triage form. Okay, so with this, you're going to see what their main concerns are. The question is this their first baby? How old is their baby? Are they expecting? If so, what trimester? What is their main concern is going to give you a better idea of, do I need to immediately reschedule this with an LC or with somebody that has a bit more experience, some of our NPs, for instance, who are breastfeeding themselves. And so when asked this question, what are your main concerns around the breastfeeding journey? If it's latching frustration, perhaps they're going to actually need to be walked through football holds or different latching techniques. So if you feel uncomfortable with that during the visit, you can actually offer them the additional lactation consultation afterwards, but just to get a better feel for what you're actually going into for the visit and prepare. So they are also asked to go ahead and to complete the intake form. And so all of this is de-identified, and so therefore it is HIPAA compliant. They're just going to put their initials. So you're going to, coincide same day that somebody will not have the same exact initials coming through the visit. And you'll see actually when you take this form yourself that it asks for permission to be able to share this de-identified data, and it also clarifies this is not a medical visit, this is wellness, general wellness advice coming from somebody that is board certified in the field. And so you're going to go ahead and walk through this intake form yourself, which they are prompted to take 30 minutes to do before their visit with you. I respect your privacy, no direct medical services are rendered here. And then this is very similar to a holistic primary care visit. You're going to get and see everything about their cardiovascular health history, their demographic info, and then from that you're going to have a better idea of how to meet their needs using this basic triage process, which I'm going to walk through. And you can always find this in the baby development tab. But our goal with every telehealth visit, regardless of what they come through for, is to really inspire confidence as well as provide education on the importance of skin-to-skin contact. So if they're struggling with latching frustration, how the natural nipple can help with that. And on microbiome development and the importance of microbiome development as well. Oftentimes, with a fussy baby or with colic, parents just don't know that it could be because of disruptants and gut bacteria. And so, for a little bit more information on how to provide that specific education, I'm going to ask you to watch our Super Baby Essentials, which really does delve into the unique gut microbiome that we can help shape by